Hi guys, this is Panda. Say hi. We're on episode 125. Welcome to the Tiny ADHD Superpowers series. Alright, so today is what is the strongest ADHD meds? God, I love talking about medications. There isn't a single strongest ADHD medication, as the effectiveness and tolerance of medications can vary significantly between individuals. The most common and effective medication for ADHD are stimulants, which include both methylphenidate, like Ritalin or Concerta, and amphetamine, like Adderall or Vyvanse. A Child Mind Institute states that these two types of stimulants are equally effective and have same benefits and risks. I disagree. But anyways, that's not the point. While the concept of the strongest medication might be misleading, hey baby, come on, say hi. It's important to understand that both methylphenidate and amphetamine are available in different formulations, in immediate release as well as long-term release. All right, go. Oh, you don't want to go anymore. Okay, fine, stay here. A doctor will typically start with a low dose and gradually increase it as needed, while also considering factors like individual specific needs, the severity of their ADHD symptoms, potential side effects, as well as the metabolism. Actually, consider dosage. I think that's one of the most important things. Is the dosage that not you can metabolize to the optimal level of ADHD concentration and focus and ability to just do everything and all together, open tasks. Ultimately, the best medication for individual with ADHD will be one that provides the most effective symptom relief with the fewest side effects. This is often determined through trial and error. Like I said in previous episodes, it's hard. Trial and error is hard, and it took me about 10 years, trial and error. More. I've been on methylphenidate for 25 years now, and but for about 10, 15 years, when you become an adult after graduation, from university, and then you start really thinking about, like your body changing, you really need to manage these meds to the optimal level, optimal absorption rate, for you to be able to function the most. Like some people are in the morning, some people are in the afternoon. I actually had one of the security guard at the hospital that came up to me and asked me, "How do you remember to take your ADHD medication?" Because he doesn't. So, my opinion, what I know, just from what he said in one or two sentences, was that first, he was on Concerta, which is extended release. So you really have to time yourself for extended release, because it doesn't work for me, because I know right away when I take the immediate release, I feel it, and I feel it when it's coming down, that I know that my dose needs to be maintained at that peak dopamine level. So there is really no best medication. It's whatever works. So if you are extended release and you can't remember to take your meds, maybe you don't need it, right? If you don't feel the same and you forget about taking it, maybe you don't need as much. Maybe you don't have ADHD at all. So those things are things that you need to think about as well. Maybe you get a second opinion with a different psychiatrist or different doctor or different physician, whatever, just to find out. And always make sure that it's an integrated team that's helping you with, your medication, as well as your therapy, CBD, which is very, very important. And the best choice will depend on the individual's needs and response to different medication and dosages, with a doctor's guidance being the most crucial point in this decision-making process, as well as your own willingness to trial and error. It's hard. Sometimes it's hard. When I was eating it, it gives me a burnout actually. Like I feel like shit. Like I can focus. I'm, like all over the place still. Whatever. It doesn't matter if those are just right or not, or right on. But that's how it is when you metabolize just in my body. So that's why Vyvanse doesn't work for me at all. So, and that's a pro drug, which I talked about in the earlier episodes. Anyways, that's all, folks. Take care.